This is Jeff Breedlove with the Georgia Council on Substance Abuse, and this is the Neil Campbell Report. And we are joined, obviously, by the Executive Director of the Georgia Council on Substance Abuse, Neil Campbell. Neil, as we always say, thank you for your time.
Thanks, Jeff. Thanks for setting this up and doing this twice a week. It's been great.
Well, I know that a lot of folks watch these, maybe not live, but we know that it gets a lot of views after we air these. And for the folks that are watching live or will watch later, these are scheduled through the month of June on Tuesdays and Thursdays. The topic is really going to focus disproportionately on peer-led recovery and the Georgia General Assembly, the state budget, and how the future of the peer-led movement is frankly on the line here from a state budget perspective over the next couple of weeks. So these will be important Neil Campbell reports for you to watch live and then go back and share these links with your peers across the state in recovery so that they're getting the latest news from our leader, Neil Campbell. So Neil, with that lead in, you have shared publicly two things. One, you did an interview with the Georgia Health News, and then you shared, of course, an update on this document that has been released by the General Assembly and posted with the first round of the staff level proposal cuts. And I'd like to ask you to just sort of educate everybody about that.
Yeah, thank you. And hopefully we'll be doing a lot more interviews with media in the next couple of weeks because we're on a fast track, as you know. So the budget cuts were submitted from agencies to the legislature last week, as you know, and or may not know. They didn't become public in a real sense. We started hearing some rumors late last week, but then by, my days are all mixed up. I believe it was Tuesday morning, we had it released to where we saw what exactly was being proposed to be cut from the Department of Behavioral Health and Developmental Disabilities. And I'll tell you, Jeff, it was a gut punch. We had expected, we had heard, the state revenue is in trouble. We're going to see some cuts. It's just inevitable. The governor last year had recommended the state agencies give him a 6% reduction. We saw what those looked like. You add 8% more to that. Somehow those cuts have been realized on the backs of the recovering community, and that's not a good thing. We saw that the Addiction Recovery Support Centers, the $4 million appropriation from 2018 that has stood up 16 RCOs across the state, peer-led recovery community organizations, those have been cut. The work that we do at the Georgia Council to support those has been cut. The peer-led recovery support in the neonatal intensive care unit has been cut, and it looks like, although we're trying to get some clarification, it looks as if our warm line and our emergency department work is being transferred to state dollars to be cut. That's devastating to the council. It's devastating to our community. I'd also like to say the Georgia Parent Support Network is realizing cuts that are disproportional to that 14%, as is the Georgia Mental Health Consumer Network. And if Georgia is known for one thing in a positive way, besides our best peaches in the world, in my opinion, it's peer support. And that the agency has been, Georgia Mental Health Consumer Network has been around for over 25 years. I think it's even closer to 30 years, but they've been doing peer support in a Medicaid billable way for 20 years. So many of their training and support services are being cut too. So it's just devastating to our community.
Well, it is. It's you were quoted as saying these are Death Star-like blows. And I think that's an accurate description that people can relate to. It's not like the staff went in with a scalpel, was collaborative with these agencies with 20 years, like also almost 30 years, as you were referencing with the Consumer Network, and showing respect and trying to find strategic ways to accomplish a reality. It's almost just literally like Darth Vader said, there's the planet, point, aim, and shoot.
Yeah. And, Jeff, as we met with our staff, we called it an emergency all-staff meeting once we knew the cuts were imminent and to be released, because I wanted them to hear it from me. In my organization, we have 35 employees. We could lose between 28 and 32 staff. Honestly, it just depends on how the cuts go. We want the Georgia Council to be around. We are an agency of consequence, and that just would devastate us.
Well, it is devastating, and you have been leading you've been leading for a long time, but you've been leading particularly in the context of this conversation for the past several days, not just with your staff, but you've convened, of course, historically, you had the ability
Yeah.
to convince the Georgia General Assembly Working Group on Addiction and Recovery to have a meeting on your platform. That's pretty incredible. Then you convene the RCOs around the state for a leadership meeting. And we'll talk about some other activities later in this conversation, but you've been leading on a fast track, to use another science fiction thing, like at warp speed. And it's been Star Wars and Star Trek combined. Don't get on me, haters. But it's it's a thing.
You're a nerd.
Right. But you know what I want to bring up and ask you to clarify for those that may not know, is that this is a serious, devastating proposal. But two things: one, it's just a proposal, and two,
Right.
it's just the beginning. So tell us a little.
Yeah. Yeah, thanks for mentioning that, because it's a starting place. It's a bad starting place, in my opinion, but it's a starting place. The other thing we heard from our legislators yesterday was that it's really important that we organize, mobilize, make some noise. Let's show how these cuts are really affecting communities. And Jeff, one of the things we've been doing a lot lately is working with our partners in these recovery community organizations to get their data together and to get our data together to show what the cuts would look like. Because I believe, honestly, if I can this is the problem too with the COVID, we don't know how many hearings they're going to be having, so that worries me a little bit. But if I can demonstrate to them that an investment in the neonatal intensive care units has a small and relatively small investment, $200,000 or so, is realizing $9 million in a year in neonatal intensive care unit beds. Well, who wouldn't do that? Why would you cut that? If you're able to shorten bed days, you're able to have relationships with families are getting connected to recovery supports. Why would you want to cut something like that? It just isn't smart for business. So we think we can make the case. So we've been meeting a lot, telling folks, get your data together. And I had a meeting with 18 RCOs this morning. I want to give a shout out to Gene Conroy, his crew in our RCO development unit with Emily Riblet and Brian Kite. They have worked with our RCO partners to show how much they have grown in the last year or two in terms of how many peers they're serving, from nothing to 22,000 a month. We're doing peer services. So it really, the number, the amount of people we are touching every day, it's got an impact on crime. It's going to have an impact on our healthcare systems, child welfare systems, you name it. Recovery affects everything. And when you're cutting recovery support services, it's not a smart thing to do.
Well, absolutely right. And I'm thinking when you're saying that this is not just a cut at some agencies and organizations that provide programs, those people, as some folks like to call us. Not at all. What this is, it's going to impact cities. It's going to impact the counties and their budgets. It's going to impact our friends at the Georgia Restaurant Association, Georgia Hospitality Association, because these workforces are combined. These are people in recovery. And when these support services are yanked out from them, the trickle down unintended consequences of impact on jobs in Georgia, on schools, on the sheriffs and police chiefs' budgets going out of control, emergency room visits going out of control. This isn't even smart, fiscally sound, budgetary decisions being made. And I would suggest, and I feel I can say this pretty good, you cannot call yourself pro-life and support cutting some of these programs. It's just not a pro-life, pro-family position.
Right. Speaking of the neonatal intensive care unit, Georgia ranks 8th in the country as the 8th worst in infant mortality in maternal health care. That, and you're going to cut a NICU program? What sense does that make? The other thing I want to say is and I know you're a policy wonk, Jeff, and we talk a lot about public-private partnerships. But when you think about these 16 ARSCs, Addiction Recovery Support Centers, we also call them RCOs, so Recovery Community Organizations, so don't get they're interchangeable. But when you think about those 16, the business model we helped them develop was that you don't have just one funding stream. You are not just state supported. So I think down in Tifton, they were given a building by the city. And so in that building are recovery support services, and they serve something like 3,000, they did like 3,000 peer services last year. I can get the exact number. So it's a model where businesses are supporting. We have Coweta Forest down in Griffin, where Hank Arnold and his crew, Noonan, where his crew is. They've got businesses that are donating to him. It's a public-private partnership that I think would make anybody proud. It doesn't say that government is the solution. It's saying that communities are the solution. And we have been, hammering that for 9 years now. We finally have these programs in place, and we're going to bust them up. It just doesn't seem right.
Right. And we could talk all day, and I find myself realizing that we need to bring this edition of the Neil Campbell to a close with two other points. And that's a great lead in. At Neil's direction, on Monday, June the 1st at 12 noon on Zoom, and this is going to be it's already up on our social media, on all our platforms, and I know others are already posting about this. We'll be emailing and we'll be getting the word out, but there's going to be a statewide recovery advocacy strategy session. I tried to put as many words in there as possible, but it's an important meeting. It's a meeting where you can get on this meeting. If you're in recovery, if you're an ally of recovery, you're a family member, whatever, whoever you are, if you support recovery. And at Neil's direction, we'll be articulating some of the strategy from our point of view that we're going to invite everybody to partner with us on, mental health allies, all allies across the board to support funding for recovery and for mental health and these important medical issues. So that's Monday the 1st. You'll hear all about it between now and then.
Yeah.
One of those rare times I say, you probably don't want to miss this meeting. It's going to matter. But
Jeff, I just want to say about that a unified message is really important. If we can come to the legislature and say, this is smart business, recovery is real, this affects public safety, and give some data around all of that, and we're all saying that same thing, it's going to have a lot of power downtown.
That's exactly right. And we're going to talk about how you do that downtown. We're going to talk about how you do it in your local communities, and we're going to talk about how you reach out to allies. I've been on the phone all morning with people. I had a great meeting with folks in Valdosta on the phone that called, and we were talking about, how they could do work in Valdosta, and I mean, all over the state. Neil's getting as many, if not more, calls than me. So we're gonna help do it locally in your community and up at the Gold Dome. And I want to end this by saying that I got in the mail the official absentee ballot. Now. It's too late past the deadline to apply for your absentee ballot, but this is the time to vote. The primary is June the 9th. So if you didn't get one of these, if you didn't apply for this, then you're going to have to look at the other options under Georgia law, and one of those may be voting in person. But Neil was dressed. Neil, let's show everybody your shirt. Look at the shirt right there. And we're a 501c3, and we can't say vote for or against particular people, but we can certainly say we can actually run voter registration things. We can say vote, vote, vote. And it's important, no matter who you vote for, that you vote. And we need to go vote. And the primary is June the 9th, and figure out your status and figure out how you have to vote during COVID under the law, and do what you need to do to get to the polling place. And
it's going to be interesting. It was the first time I had an absentee ballot. I've usually liked to, I'm a child of the 60s. I like to exercise my right to vote by going in person, but I thought, well, I can't go out. So I got my partner and I got an absentee ballot. And I'm telling you, I sat there with my tablet and the names, and I was able to look up. I think I was the most informed about policies, about issues that were on the ballot, as well as about candidates than I've ever been. So I actually really liked it. I think I'm going to start doing it now. So I thought it was interesting. So,
well, I've
not that I was.
Yeah. No.
I didn't just usually make stars or anything. I usually had some idea, but this was, you could actually do research if you didn't know. So I thought it was great.
Well, that's a good point. And now we're really getting in the woods. One time I lived in Oregon, and Oregon is an all vote by, you have to vote by mail. And they sent you these big, thick books, because every candidate got to have a page, right? And so, wow. A big book. And you had to vote by mail. And that was fascinating to do that. I love going in person though, but Neil's point is great that she got to do some more research on her own timeline. So that's pretty good too.
Yep.
However you vote,
Yep.
it's important that you vote. This is the Neil Campbell report. This is Jeff Breedlove, and I'm so happy to have Executive Director Neil Campbell with us. Again, get ready for Monday, the 1st at 12 noon. Get on the
Yep.
meeting. Don't forget on June 9th, we're going to have the car rally at the Capitol. That's a big deal too. That's also at 12 noon. Plenty of information on our platforms about those two big events coming up. This is a time to bring Neil's slogan of nothing about us without us to life and make it real.
Thanks, Jeff. I appreciate it. Bye, everybody.
Recovery's real.